Hello, my name is Brooke Gelman. I'm a PGI-1 pharmacy resident at Piedmont Athens Regional, and today I'm going to teach you how to receive free drugs for your patients through the implementation of patient assistance programs at your practice. Everyone involved in the creation of this presentation has nothing to disclose. By the end of this presentation, you should be able to understand the benefits of patient assistance programs and apply the basic steps required for the implementation of these programs. So what are patient assistance programs? Patient assistance programs, or PAPs, are available through certain drug manufacturers to provide qualifying patients with name brand medications at no cost. They were created to assist the uninsured or underinsured patients in controlling chronic disease states with medications that they could not afford under their current circumstances. So why would we want to use PAPs? How will these help patients in the long run? Well, it's no secret that medication costs have increased over the past few years, an increase so significant that many may be forced to go without necessary medication due to high copays. This is especially true for those who are uninsured. If they are forced to go without certain medications, they run the risk of experiencing adverse effects from their disease states. For example, a diabetic patient may develop diabetic ketoacidosis from going without insulin, or a COPD patient may experience an exacerbation from going without an inhaler. This leads to increased acute care utilization, so more ED visits and more hospitalizations, and now these patients have to worry about a hospital bill on top of the medication cost. Fortunately, this cycle can be broken with PAPs. So what are the benefits of PAPs? The obvious reason is qualifying patients can save hundreds of dollars per month by receiving free medications, and having consistent access to necessary medication can increase adherence. And with being compliant with medication regimens, this will keep these patients out of the hospital, so everybody wins. For whatever chronic disease state that you are trying to treat, there is likely a PAPs available to provide medications that could treat your specific patient. But listed here are some of the more common medication classes that we see at our clinic and certain brands that you may see. This includes anticoagulants, inhalers, insulin, and other anti-diabetic medications. So why don't all practices do this? Crazy, right? Well, there are a few reasons why you may not be familiar with PAPs. To list a few, there is a severe lack of literature available to prove the efficacy of these programs, but this is slowly growing. Also, some providers may not have the resources available to dedicate to finding these programs for patients, and some just may not know where to start. But you can cross out that last reason because I'm about to explain how you can set up your own PAP system within your practice. First, you need to find someone to keep things organized and essentially take ownership of the program. It can really be anyone in the office, such as a nurse or a medical assistant. However, it is much more preferable to have somebody with a background in pharmacy, like a pharmacist or a pharmacy technician if available, because this person would be a little more versed in possible therapeutic interchanges. An example of this could include interchanging a patient from Levemir to Lantus because the patient meets the qualifications for the Sanofi program. And listed here is an estimated FTEs that was created for our program based on the amount of patients that could be enrolled in PAPs. Once you determine who is going to run your program, it's time to determine how you find qualifying patients. This part is relatively easy. A patient must meet criteria for low income, and what that generally means for most programs is an annual household income of less than or equal to 400% of the current federal poverty level. The patient should not have prescription coverage. However, there is an exception for some programs on this. Some patients can still qualify with high out-of-pocket cost on Medicare Part D. So this is something you can keep in mind for your Part D patients. Finally, the patient cannot qualify for Medicaid. If the patient meets all of the listed criteria, then there is likely a PAPs program they can sign up for. Most PAPs programs have simple applications, but all will require this basic information: a prescription from their provider, Most programs will send a 3 to 4 month supply, and this will automatically ship once the patient is due for a refill, so the prescription will need to be written appropriately. Also, patient identification by either a social security number, a tax ID or birthday, and the patient's signature. There are a few programs that may require a little more documentation, such as proof of income, and some will perform a soft credit check to ensure the patient is being honest about his or her income. Finally, most PAPS applications are good for 1 year, and the applicant will need to reapply each year to ensure he or she still meets qualifications. If the prescription needs to be updated before the patient needs to reapply for the program, and the patient will need a larger supply of the medication, you can reapply early with the same process and an updated prescription. Now that we are past the application portion, you will need to keep proper records of patient enrollment in each PAPS. There are some programs available for purchase to assist in this documentation, but at our clinic we have a password-protected Excel form that is only accessible to the supervising pharmacist and pharmacy buyer. And we keep track of the following information: patient name, birthday, PAPS manufacturer, medication, prescriber, and when they will need to reapply for this program again, just like the example listed here. You will also need to keep a record of when the medication is delivered and when the patient picks up the medication. This is an example of what our record would look like for this patient. And we would also publish a note within the patient's EMR with the same information each time the medication is delivered and picked up. Another vital part of this process is where you will store the medication once it is delivered and awaiting patient pickup. Georgia law states that all medications must be stored in a safe and secure environment. This can be satisfied with a locked room or cabinet, and if the medication requires refrigeration, then the refrigerator must be secured as well, just like the picture. You must also be able to provide proof that these medications are stored within the proper environment to maintain the drug's safety and efficacy. Non-refrigerated meds must be stored at 20 to 25 degrees Celsius, refrigerated meds at 2 to 8 degrees Celsius, and medications stored in a freezer must maintain a temperature of less than or equal to negative 15 degrees Celsius. The best way to keep track of this is with an electronic temperature log, so you can download daily temperature readings, and these logs should be kept on site for a minimum of 3 years. Now what do you do once the medication has arrived? Most programs will deliver to the prescribing medical office, but some will deliver to the patient's home address. At our clinic, we require the patient to pick up all medications from our clinic so that we can continue to assess their compliance to medication, and this deters them from missing follow-up visits. Another benefit to having the patient pick up the medication at the office is we can check in to make sure they are still using the medication appropriately. Things to look out for could include: is the patient picking up every 90 days as they should, or are they trying to get refills sooner and possibly using too much of their medication? Also, if the patient is being transitioned to another medication or a different form of the medication, then we can answer any questions that they may have and counsel them. Such as a patient switching from insulin vials to pens, we can explain to them how to dial up the pen, how to use pen needles, and reiterate that they should not be using any old medication. Another thing you will need to consider is how to properly label medications for your patient, since you are technically dispensing a medication to them. Some manufacturers will have pre-made labels on products that match instructions on the prescription. Others will only send the bare product in quantities sufficient for one refill, and it will be your responsibility to ensure that the patient has the current instructions available to them. Creating a prescription label does not have to be intricate, though. You only have to have the following information to meet Georgia state requirements, and this includes the name of the provider with the office name, address, and phone, the patient's name, and the name of the dispensed medication with dosage, route, and frequency. The easiest thing to do is to create a template in a Word doc or similar program with the basic information that fits on every label. Then you can customize the patient information for each patient and prescription. For example, at our clinic, we have a few sheets of pre-made Lantus prescription labels, and then we will handwrite the patient's dose and frequency on the label. And just a reminder that this is not a lifetime supply of the medication. Each patient will need to reapply every year. So now let's look at a patient case. BC is a 45-year-old construction worker. His hours were recently cut to part-time and he lost his insurance. He is concerned because he knows the cash price for his Levemir is very expensive. He presents to his primary care clinic to find a cheaper alternative to this medication. Luckily, BC's primary care physician recently hired you to create a PAPS service in this office. Can you help BC? So the first question to ask yourself is, does BC qualify for PAPS? In this example, we are going to assume that BC meets the criteria for low income. We know that he does not have prescription insurance anymore, and he does not meet eligibility for Medicaid. So yes, he does qualify. So what are his options? He has a few different options actually. There are 3 major companies with long-acting insulin products that have PAPS. Option 1, he could stay on Levemir and provide the appropriate information to apply for the Novo Nordisk program, which is listed here. Option 2, he could switch to Lilly's long-acting insulin product, Basaglar, and provide the listed documentation. Or option 3, he could switch to Sanofi's product, Lantus, and in this case, he would not have to provide any additional information. Either option is completely up to the patient and the prescriber. Once the medication has been selected, send the application to the respective program and document the necessary information. So what are the next steps? Once the medication is delivered, document the arrival and call BC to let him know that it's ready for pickup. Store the medication in a monitored refrigerator and document when BC comes to pick it up. Also remember to counsel him on any changes in medications if this applies. If you have any questions, please feel free to email me or my advisor for this presentation, Whitney Huddleston. Thank you for watching.